So now we're going to talk about the names of movements of joints. So we talked about types of joints, but now we're going to talk about the movements they can create. So often the movements of joints come in pairs, one to do one action and then one to do the reverse of that action. And so here's abduction. This is moving moving a limb away from the body of the midline of the body. And what that means is, like, if you have your arm straight down at your side and then you just lift it straight away so it's still in line with your shoulder, that is abduction. Adduction is where you bring it back down to the side of your body. Extension, hyperextension, and flexion. So this is a situation where we'll start with flexion. So if you have your arm out, then you bend at the elbow. You are bringing your forearm, the part of your arm that has your hand on it, closer to your upper arm. So that is decreasing the angle between those bones. So that is flexion. Extension would be bringing that arm back down straight. You can also do that same action with your wrist. So you can bend at the wrist, reducing the angle between your hand and your forearm, and then extending it would be putting your hand out back straight. But hyperextension is where you fold your arm or your hand back the other way. So it's getting closer to the back side of your forearm. And so just kind of think about, not every joint can hyperextend. In some situations, hyperextension can actually cause damage to the joint. So flexion and extension are really the reverses of each other, but hyperextension is also an option in some cases. So wrist movements, these are specifically things that the wrist can do. Supination is where you put your palms upward. Pronation is where you put your palms downward. The way I think of and try to remember these is supination with your palms up is like begging for supper. Supper, please. And then pronation, I just remember, as the opposite of that. Circumduction, this is where the body part moves in a circular motion. So, like, if you think about moving your hand in a circle or your arm in a circle, so that the end of the limb that you are moving makes a circle. You could track the circle at the end of your limb. That's circumduction. That's going to be really important to remember because there's going to be one that is very similar to this, but it is not the same. Elevation or depression, this is bringing something up in front of you. So whereas adduction, you brought your arm out away from the side, and then adduction brought it back down to the side. Elevation is bringing your arm up in front of you. Depression would be lowering that back down. Protraction and retraction. I remember this from Night at the Roxbury, which is a really old sketch on SNL, where, like, you put your chin forward and then you bring your head back. And it's kind of that, like, chicken bobbing motion. So protraction is putting your chin forward. Retraction would be bringing your head back. And you could do that with anything. Like, you could do that with your shoulder. So that's just how I remember those. Rotation. This is the one that can be very easily confused with circumduction. Rotation is where, like, you're turning your head side to side, like if you were trying to indicate no. That is rotation. Circumduction is where you're making a circle path. So practice the difference between those two. physically, so that when you start to have to try and test over them, you have a lot more understanding around that. Plantar flexion and dorsiflexion. These are where you are moving on your feet. So plantar flexion, I kind of think of it as you're planting your feet and raising up on your toes. Dorsiflexion is where you're rocking back on your heels and you're bringing your toes up. So standing on the balls of your feet or standing up on your toes is plantar flexion. And then if you bring your toes up and you're just resting on your heels, that's dorsiflexion. Eversion and inversion. Eversion is where the sole of your foot faces away from the midline of the body. These two are generally only discussed when you look at a sprained ankle or a broken ankle. We discuss them because usually you're not, turning the sole of your foot away from the midline of the body, nor are you generally looking at your foot where you have turned the sole inward towards the midline of the body, which is inversion. Generally, we talk about these in situations where something has gone wrong, like a sprained ankle or a broken ankle, and we talk about the ankles or the foot's been everted or inverted. And we might talk about it if we are looking at occupational therapy, where we're trying to understand someone's gait and maybe they're walking on the outside edges of their feet. So we may say that their gait is inverted. So we're talking about the sole, they're walking on the outside edge instead of flat on their foot. And so those only really come into play when we're talking about something going wrong, whereas the other ones all really describe movement. Opposition, this is where you can touch your thumb to the tips of your fingers. That is what makes our thumb opposable. It is not that it's posable as in it can strike a pose. It is opposable in that it is at opposition to your fingers and that you can touch your fingers to your thumb. And so that is going to round out our discussion of movements.